Hi, this is Dr. John Sinnott again, courtesy of Tyler Comrie, a wonderful artist. We see behind us the spread of COVID in the first couple months of the pandemic. It was inexorable, it was broad spread, it was predictable. Also, it mirrors what could happen with any pandemic. And I assure you, this is not the only pandemic we're going to see. Looking at Shakespeare and King Lear, we hear that it is a time of plague when madmen lead the blind, and it's never been more true than it is now. So what we want to attempt to do is bring a little bit of order and understanding to the pathophysiology of the initial infection with coronavirus 19. On the left side, we have a schematic, and here you're looking at a lateral section drawn through the nose. In blue, you see Kiesselbach's plexus. This is where we all get bloody noses from because the blood vessels are so close to the skin than anywhere in the body. This is the site where infection occurs with COVID-19. It binds to the angiotensin converting enzyme receptors, the ACE receptors, and from there invades the blood vessels. If you were to look on the right side of the skull I'm holding, you'll see I've indicated that area where what are known as emissary vessels, because they go back into the cranial nerves are found. Once they enter the nerves, they undergo what's called transsynaptic transmission. In other words, the virus uses the nerves to spread, and from there, it enters the bloodstream and the brain. On the right side of the slide, you have a typical blood vessel that's providing nutrients and oxygen to the central nervous system. And if you notice, these virus particles actually enter the central nervous system, going between the tight cell-to-cell junctions through the parasite. At the same time, if you look at this slide, there are two different sections, one on top of the other. The endothelium, the lining of a blood vessel, is what's known as a paracrine gland. An endocrine gland affects cells distant to itself, like the thyroid gland, like the adrenal gland, whereas a paracrine gland affects cells adjacent to it. Here, infection results in some delamination, shown by the arrows here, and then, as it disrupts the cell, you derange clotting. This is extremely important because this is the phase that people have strokes, heart attacks, deep vein thrombosis, etc. We like to call this, in many ways, the thrombotic phase of infection. As soon as we start seeing this, you know there's going to be blood clots where there shouldn't be. For this reason, many people will be started on low-dose aspirin for a month, or with risk factors, even an anticoagulant. As the blood vessels get infected throughout the body and the brain as well, you have fever and a mild cough. For most of the variants, it's about 4 days, but we know for Omicron, it's really about 2 days. So during those 2 days, you're contagious, okay? And then you become symptomatic. Your symptoms are initially fever, perhaps a mild cough, but overall a feeling of immense malaise and a bad headache as tissue around the brain is involved. The next phase, about 4 to 5 days later, is the pulmonary phase, where virus is replicating in some lung tissue. The person by then is short of breath and has a cough, and we enter the most dangerous phase, which is the host inflammatory response. There you have a systemic immune response syndrome with oftentimes kidney failure. People end up on ventilators or even undergo ECMO or extracorporeal membrane oxygenation. This is known as the hyperinflation phase. This is a very dangerous phase. We try to avoid it. We avoid it by giving remdesivir early on. And we also try to manage this with steroids and at times interleukin-6 inhibitors. It's this phase that has the greatest mortality in the elderly and those with underlying immune deficits.
Hello, my name is Ava Milani. I'm going to be discussing the dynamics of transmission of COVID-19. There are two terms that are really important that we all know and understand when discussing this disease. The first is called R0. It's also the reproductive ratio. This represents how many people are infected by each patient. So when one person becomes infected, they can spread this disease to a number of other people. For example, when our first variant emerged, Alpha, the R0 was around 1.7, meaning each person on average spread the disease to about 2 people. We've seen with Omicron, the R0 is much, much higher, around 8 or 9. So that just shows how important it is to understand that the more contagious it is, the more people will become infected and the greater the strain will be on the hospitals. Next is the serial interval. This is the number of days from exposure to the pathogen that a patient will become contagious. So with these two factors, it's important to see that if we have a greater R0, meaning more people are becoming infected, and a smaller serial interval, meaning there's less time between exposure to contagion, we really have a nightmare scenario.
This infection can have lasting impact. The mechanism of this is unclear, but even patients with mild disease can have health problems for months to years afterwards. They can have cardiac arrhythmias, fast heartbeats, they can be short of breath, have chronic cough, kidney injury, joint pain, musculoskeletal problems, headaches, profound headaches, loss of smell, etc. This is called long COVID, and it affects about 5% of patients that are infected with corona-19. I encourage you, if you have long COVID, to use a medical doctor to guide you through this phase of the illness. Many people that are not physicians are offering treatments and therapies that will not help you. A good family practitioner or a general internist is a good place to start. And I encourage each of you to read about long COVID. I think it's going to be with us for several years. I want to thank all of you for taking the time to listen to what today is a podcast and hopefully learn a little bit about the virus and how it makes us sick. We appreciate very much your interest, and Ava Milani is going to finish up with a few words.
Hello, everyone. Thank you again for tuning in to this YouTube COVID talk. I'm just here to remind you all of the importance of getting vaccinated and now boosted so that we can combat this deadly disease. Vaccination really is effective at reducing your risk of hospitalization or death. And even with the new variants, it has been shown to be very effective. So the benefits are truly worth it, and will also be able to prevent long haul COVID side effects. Thank you again, and we hope to see you guys back soon. Thank you. Bye bye.